Again to AHO Radio. I'm Jerry Bowles. I'm your host again today. I am honored to host again this segment of AHO Radio. AHO Radio is aired as the agent services and training platform for America's Health Options Insurance Plan. Today, you are in for a treat. We have a very powerful visionary. Actually, we have two of them. And first, Mr. Richard Spalter, who is going to be reshaping how we do presentations and how we actually build out these quotings. And not only is he reshaping the future of health insurance, but insurance in America in general. And our very special guest today is Mr. Clive Fowler. He is the CEO and managing partner of America's Health Options. Without further ado, sorry about the stumble there, Mr. Fowler. Can you hear me, sir?
Yes, sir. I do hear you, Jerry. And thanks again for hosting this section of AHO Radio. Richard, I want to appreciate you being here and for being able to walk us through our new quoting system that these guys are going to take a look at later on. They're going to really appreciate what we have done here. Right off the cuff, we'll just start out. And what you're looking at right now, guys, is our leadership team. And yes, I do understand that there aren't any women on the leadership team at this particular point in time, but we're changing that. We're avidly looking for someone of the female sector to fill some of these key positions for America's Health Options across the country. We're going to jump right in and take a quick look at what we got here. Now, what we've done today, we wanted to, in a brief synopsis, take our brochure plan and we reduced it into a one-page flyer component that you can use both sides. And basically, this is designed for the advisor to be able to do guerrilla marketing, where you can have a leave behind platform to leave with the client, or you're able to actually walk through that product right here from one page and show them. The product, as most of you already know, and across America today, we are saving people 30 to 60% off of their current health insurance plans when they're compared us to the ACA. What most of you may not remember, as a quick refresher, our product platform comes with a $5 million lifetime benefit for that client. So if there's a family of 4, that's $5 million per individual. So you're looking at $20 million worth of benefit in that house. The product platform allows the client to see any doctor, anytime, anywhere in the U.S. You can see specialists without referrals. You can use any hospital in our nationwide PPO network. That's correct, a PPO network. It has no deductibles, a true no money down experience for the client, because the client will have the unique opportunity with this product to be able to partner with the health insurance company, and they choose, the client chooses how much percentage of benefit that they want per day. That's quite unique, and you'll hear more about that later on. It covers hospitalization coverage. It has emergency room benefits, outpatient benefits, and doctor's visits. It comes with a unique $50,000 lump sum critical illness benefit platform. And that is an immediate based off of diagnosis only. It comes with accident. And that accident product not only provides for the accident on the front end of the situation, that when someone has a need, but we took care of the back end of the accident, because it comes with a maximum of up to $2,000 or 60% of that person's income in disability payments for up to 24 months. That's pretty strong. It also comes with prescription drugs, which is based on a true formulary plan, not a discount card. It comes with dental, which is also available in here. And it comes with 24-hour, 7 days a week, 365 days a year, board certified telemedicine physicians available to you. That means at 3 o'clock in the morning, if you have a need, you can pick up the phone and speak to a doctor either by video or telephonically to fill your prescriptions or to get a diagnosis to meet your needs, thus reducing the requirements of you going to the emergency room all the time. It also comes with a very unique concierge benefit. I cannot stress to you how important this particular service is. That concierge benefit allows you as a client to be able to call a care provider and have someone be able to source care providers for you, have them renegotiate your bills, have them go ahead and discuss your surgery situation for you to help you with that. It is an extremely powerful, powerful tool, and you're going to find that you'll be able to have your bills reduced as a result of that. Then it also comes with the minimum essential coverage plan. This is available in here to provide 63 services for men for wellness services and 67 wellness services for women. It covers all of your annual physicals. And if you're within network, it's free of charge to you. And it also provides, while this is still available, it provides for the ACA tax compliance benefit, where you will receive a 1095A at the end of tax season, so that you will not have to pay a tax penalty. It also comes with a very, very unique return of premium feature that's based on a life insurance chassis. This particular feature right here is so powerful. The complaint has always been, what do I do? I've paid so much money for my health insurance. I didn't need it necessarily, but I had it as a precautionary issue, and I got nothing back. Well, this particular platform here allows you to receive cash back, but it also, more importantly, provides additional catastrophic benefits for you to complement your critical illness. God forbid, should you have a heart attack, stroke, cancer, renal failure, any of these major issues, you have additional monies coming to you to help you and your family during times of crisis. Let's take a quick look at how our plan stacks up against a major medical plan. Now, what you're going to notice here, we're looking at a Blue Cross plan right here. And we're looking at a family of 4, a 51-year-old male, a 43-year-old female, and 2 children. They have a family deductible of $11,000, maximum out of pocket of $13,700, and a monthly premium of $1,950. If you notice here, we have a 0 deductible. We don't have a deductible on our plan. That's the beauty of this. But if you notice what we did here when we compared the platforms, our client is receiving $1 million coverage per person in the household. That means in this case, there's $4 million worth of benefit for that family inside of this household. They get their minimum essential coverages that covers their tax exemption and takes care of all of their necessary annual wellness visits. They got $50,000 worth of critical illness per family member, per parent, and $10,000 on each child. They have accident with disability here for 12 months worth of coverage. They have a dental plan in here with $2,000 worth of benefit per member of the family. And they also have that unique return of premium feature with the additional catastrophic benefit. And look at how it came in. $1,950 over here versus $1,277. I'm not sure if you are seeing what's happening here, but there is a $672 monthly savings for that client. $8,000 annually. That's pretty strong. But it gets even better. Let's take a quick look at what happens with a major medical insured patient versus a fixed benefit insured patient. Here we're going to see an MRI on the foot. This was taken in Flint, Michigan at Regional Medical Imaging Center. The self-pay patient or the fixed benefit insured patient cost is about $379 versus the major medical insured patient of $445. And this is as per Aetna. The tonsillectomy that was done here was done in Mesa, Arizona at the Banner Desert Medical Center there. And it's $2,858 for the fixed benefit insured patient. And it's $5,442. And this is as per Blue Cross for the major medical insured patient. Now let's take a look at an MRI again on the knee. Here this is taken in Boulder, Colorado at Boulder Community Hospital. It's a $600 benefit cost here to the fixed benefit insured patient, and it's an $1,100 cost on the major medical insured patient. And this is as per Arizona of Blue Cross. Now, I don't know, but this is pretty significant savings here. There's a unique difference between us versus them. Now, as an advisor, the biggest concern is you can have the greatest product on the planet, but how do we make any money with this? But I'm glad you guys asked. We've made the agent commissions simple. We've made it so simple that while you are protecting your client's health, their life, and their wealth in 3 easy steps, you need to take care of yourself as well. And we're going to show you how we'll do that right now. Let's take a quick look and compare some commissions between a major medical versus a Health Choice Select stacked option plan. As you notice here, and this is Blue Cross Blue Shield, this is their silver plan versus our fixed benefit Health Choice Select silver plan. And as you can see, we took a family of 4 again. We did a 48-year-old male and 49-year-old female, and same thing over here, and 2 children. They're using the same deductible here. This family deductible was $13,000. Maximum out-of-pocket expense here was $14,300. Their premium was $19.50, and look what's happening here with the commissions. Blue Cross pays them $125, or what we would call a PMPM of $15 for this particular case. Now, this is a 700, and so $60 is what it really came out to, because it's times 4 each member of the family, which is $60 times 12, which is a $720 income is what you would have made for that particular case. Let's take a look at what happens with America's Health Options Health Choice Select Fixed Benefit Stack Plan. So now, if we took our fixed benefit plan and we came in at $1 million benefit for that client, each one of them, and the premium is $665.14, and you made 20% commission of that, you just made a total of $1,596. We added the minimum essential coverage in there at $165, and you made $4 on that, multiplied out for the year, you made $48. The critical illness here, we put critical illness at $135 in premium at 65%, and you just made another $1,056. The accident with the disability is $133 for that whole family. You made 45% on this one, and now you've got $723. The dental plan, $60 in monthly premium and 35%. Now you just made another $254. When we added our life component in here, now it's $100 monthly premium and 60% income on that, and you just made another $720. This is the beauty of the stacked option selling. It allows you to also stack your commissions. Look at what just happened here. Our total premium here is $1,260 versus $1,950 over here on Blue Cross, and $720 in income on Blue Cross, but your income is $43.98 in this particular scenario. This is what your commission is. I don't know what to tell you, but that kind of commission payment is extremely, extremely strong. Let's take a look at what happens if you were to sell 4 stacked options for the month. If you sold 4 ACA plans at a $1,200 a month in premium, and you're looking at $4,800 right here in total monthly premium. But because your average commission rate is $15, your average agent is making $120, but we put 6 here because that price is so expensive, the client is probably not going to keep it more than 6 months. You've made $720 though. That's not bad. That's not bad. But look at our Health Choice Select option. Now we're practically 50% cost of the premium, just a little over 50% of the cost of the monthly premium, and this is just for Health Choice Select alone. We did not put the complete suite in this, but I wanted you to see exactly how this works. So now $4,800 a month on major medical versus $2,660 on our fixed benefit Health Choice Select platform, but instead of $15, you're making 20%. You're looking at a $532 income right here. But because it's 50% less versus the ACA, that client is more likely to keep that for 12 months. Look at the difference in your annualized income. $63.85 versus $720. But that only tells you if you sold the Health Choice Select by itself. I want to show you what happens when how you build your business using our AHO Health Choice Selects fixed benefit option suites. Let me show you how this works, guys. I want to break this down for you now, showing you where if you sold 4 stacked options a month, 12 stacked options a month, 24 stacked options, or 48 stacked options, or 96 stacked options. Okay, and this is an annual issue. We'll show you how this works out. Okay, what kind of income you will make annually, but we've broken this down to what kind of income you will make monthly, as earned take-home pay. That's what you need to understand here. Now let's take a quick look at this. If we were selling 4 stacked options, okay, off or Health Choice Select plan, we're looking at a $665 premium times the 20%. Your commission is $50.96 here. Okay, your annualized commission for those 4 works out to be $63.85. What happens if you did 12 for that month? Look at that. Jumps up exponentially. Now you move from $6,300 to $19,000. At 24 stacked option plans, we're looking at $38,000 in annualized income. $76,000 at 48, and $153,000 in annualized premium at 96 stacked option suites. But you're only looking at one portion of the stack. Let's look at what the next piece is. You add the MEC inside here. And the MEC now calculates out, you'll see it's $4 on the MEC, 48 if it's 4, 192, sorry, if it's 4, 576 if it's 12 stacked options, 12 MECs in here, and annually, and 1,152 if it's 24, 2,300 if it's 2,300 if it's and at 96 it's $4,600 is what that's coming out to be. Now, I want you to understand something here. You know, this is monthly income. Okay, I want you to understand this here. Okay, it's a total of 96 apps, stacked apps for the year, not monthly. Okay, but now check this out. Here now we're looking again. We've got when we add the critical illness in, and in this scenario we use the $30,000 and the $10,000, $135 in premium, 65% in income, and at 4 stacked options, you got $4,200 here. You got 12,000 if it's 12, 25,000 if it's 24, 50,000 if it's 48, and 101 if it's 96 for the year. We're just talking about the year here. And we're going to show you the beauty of stacking these things. Accidents, same thing, 45% income versus that 133 premium. You're looking at $2,800 for 4, 8,000 for 12, 17,000 on just the accident alone for 24, 34,000 if it's 48, and $69,000 on that full stacked option suite. Okay, if it's 96. Now we add the dental in, and the money just keeps rolling. I mean, you can see this here for yourself. When you add the life component in, look at what happens now. You're adding additional monies into this. But I want you to see something, guys. Here is what your total is. If we took that $1,260 monthly premium, and we did that times 4 stacked options here, and that gives you a $17,595 annualized premium, that equates to you at a $1,466 monthly income take home. You can start to plan your budget. If you did 12 stacked options, you're looking at a $4,300 monthly income with a $52,000 annualized premium. At 24, you've just crossed 6 figures, and you're making $8,700 a month. You're taking home a month. That's a beautiful thing. But when you get to 48, look what happens. Now you've just crossed into $200,000 income in annualized premium. But here is where you are at $17,000 a month. And at 96, you've just made $422,000 or $35,000 a month. Now, if that doesn't change your life, I don't know what will. But that, my friend, is how you build your business. You build it off of applications, not off of cash needed. The money will come, but I don't think any of you have ever sat down to really break down how that monthly income works. And I got to tell you, I can't take any credit for this, guys. I got to give the credit to our national sales director, Jerry Bowles. He's the one that really said, hey, look, we've got to break this down to the guys so they can see it on a monthly basis, how this is going to work so they can actually build their business and make a living for their families while they're helping their clients. Now, the problem is, how do we make all this happen? I'm glad you guys asked. Remember this? This is a one-page fact-finding worksheet. And in this worksheet is broken down everything you need to know. You're going to collect the information for the client up top. Once you collect that information, you're going to make the comparison between what they're paying on monthly income versus what their desired monthly premium is going to be. Once you've done that, then you're going to start to build the plan. Building the plan. You got the MEC built in here. You select whether they want the Health Choice Select or the Health Saver plan, depending what state you're in. You're going to put in here all the other ancillaries, the accident, the disability, the prescription drugs, the critical illness, and the dental options in here. And then you're going to have the option of being able to show that client what their proposed new premium will be versus the monthly savings versus what they were paying. And it's simply a matter of what issue date do you want, Mr. Client? Do you want the first of the month to be drafted, or do you want the 15th of the month to be drafted? That's pretty much it in a nutshell. But it gets even better, guys. We're getting ready to show you an exclusive, only to AHO, an exclusive new quoting system that we have here developed by our IT director, Mr. Noah Spalter, along in conjunction with Richard Spalter, our RVP out of Michigan. And I want to put this together here for you. We're going to turn the controls over to Mr. Spalter right now, and he's going to walk you through how you actually make that quote using the ACA versus our platform, and including our unique life return of premium product with the catastrophic supplement for the critical illness. I'm going to turn this over to Mr. Spalter right now, and he's going to take it from here. Richard, are you there?
Thank you, Clive. I am here.
Okay. So on you, Richard. Go ahead.
Okay, we're going to take a look now at the new AHO quoting system. And we're going to start out with creating a lead. So what we're going to do is click over here on New, click on New Lead, and we're just going to make this for Tom Smith. And I'm going to put in all the other data. Okay. And we're just going to put a fake email address in here because we're not doing a real client. Okay, let's get the city in. Okay, we have the state, we have the zip code, and now we have the county, which automatically populates. We're not going to put income because this person we're not doing anything to do with the subsidy or anything. We're going to click on married, and this person is married, and they have 2 dependents. Now we're going to fill out the information for the family. Okay. And Tom is a non-smoker, male, primary. Then we're going to put his wife Julie. Okay. Put her birth date. And her social security number. She is also a non-smoker, female, and spouse. And we put the 2 kids in. Put Tim. We're going to put social security number. And we sure hope Tim's a non-smoker. And we're going to put dependent. We're going to, last but not least, we have Sam. And Sam was born in 2002. Get his social security number in there. And he's also a non-smoker, male, dependent. Okay, so now we have all the data in there. We're going to click on Save Lead. And a box will pop up that says, would you like to get a quote now? So we're going to put yes. Okay, so the first thing that comes up is the ACA, the marketplace plan. So whatever zip code that you are in, the plans in your area will come up. So what I'm going to do now is we're going to pick a plan. The area I'm doing now is Michigan, as you can see, and I'm going to do a Blue Care Network plan. So to make things simple, I'm going to click off all the other carriers. And we're going to do a silver plan. So again, just to make it easier, we'll click off the other categories besides silver. And we are doing an HMO. So that's going to leave us with what we want. And we are going to do the Blue Cross Preferred HMO Silver Saver plan. And that's, again, a plan in Michigan with Blue Care Network. So what we're going to do is go to Add to Proposal. You click on that, and we're going to put that in the first column, option 1. Okay, so we have the first column all set. Then we're going to go to an AHO plan. So we go to option 2. We're going to select Health Choice Select. We're going to put an accident plan in there. We're going to put a critical illness. And we are going to put a prescription plan and a WellMec. So once you've clicked on all those things, you just go below back to the same things. So Healthcare Select, we're going to do $1 million plan, silver, with a 50% first day hospital benefit. And we go to accident. We're going to do 2 units of accident, which is $4,000. Next, we'll do critical illness. We're going to do $50,000 of critical illness. Then the prescription coverage, we're going to do brand wrap 1. And last but not least, we're going to add in the WellMec plan, which is going to give them, make it so the plan is compliant and they don't have to pay a fine, along with the wellness benefit. Okay, so as you can see, it shows the total premium on the bottom there of what we've selected. And it also shows you the breakdown for each part of the stack, how much each one is. So let's go and do one more here. We'll do Health Choice Select. We will do accident, critical illness. We're going to leave just the discount card on this plan. And we're going to do the WellMec. So now we go back and choose our benefits. So we're going to do $1 million, silver. This one will do the 20% first day hospital benefit. Accident will also do 2 units. Critical illness, we're going to cut that down to $20,000 because this is going to be the third choice. We want to make it a little cheaper. And the WellMec is going to also be included here. So you can see also the prices on that one. Now we're going to go up to the top and we're going to click on proposal. So we do that and it gives us just an initial view of what that proposal looks like with a comparison in each category for each of the plans that we're looking at. But before we look at that, let's go up to actions here. And we're going to click on Generate PDF. And when we do that, it generates a beautiful PDF to show your clients. and it'll have on the PDF, doesn't have it on this one, but it'll have prepared by with the agent's name on it, the agent's phone number over here, and who it's prepared for, as you can see, Tom Smith. Okay, so this is our proposal, and as you can see, it goes through all the categories that you can go over with the client, starting with the PPO network, the annual maximum benefit, going all the way down. It's going to show for each category how it stacks up against the other plans that we're showing. If we go down to the bottom here, you can see that the marketplace plan, which was an HMO, is $1,303. So we have some great options for them at $860.05, $757.09. And actually, I'm going to add one more thing to here. Let's go back. One thing I wanted to add on that I didn't is our Flex product. So if you click on where it says Freedom Flex, so for option 2 and 3, we're going to add in, I'm going to add in $75 for option 2 and $50 for option 1. We are going to add in critical, you know what, it already has the critical illness in, and it has the monthly disability income benefit, which just adds more to the stack of benefits. It'll increase the critical illness and increase the disability. And it shows you here that this person at age 65 would have an estimated $174,825 cash lump sum benefit at age 65. So now we're going to go back over here and we're going to regenerate the PDF. Okay, so everything's the same, except now you can see at the bottom that, let's see here, there we go. At the bottom, not only does it have the premium for each plan on the very bottom, but it also shows with the Flex product that on this one you have an estimated lump sum of $174,000 at age 65, and this one $115,000. So I'm sure you've heard a lot of your clients say that I pay all this money for the insurance and I get nothing back. By adding the Flex product in, they will get money back at age 65. It also shows life benefit that you have with it, which is on this one is $56,000. The third column is $36,000 and change. And that's how the individual. Yeah.
Richard, I gotta say, roll back to that a second, Richard. This is phenomenal. Let's just look at that one quick second again. So what we're looking at here with the major medical, they still even have the option of being able to offer any of what we're offering, but yet still they're milking the client for $1,303 every month. And we're saving the client several $100s per month and giving them a lot more value. We're basically protecting their health, we're protecting their life and their wealth all at the same time. And the fact that they have 50% of that face amount as additional catastrophic to go along to complement the 50,000 critical illness that you built into the Health Choice Select plan for them. That's a beautiful thing. So in option 2 here, that $56,000 face, 50% of that becomes additional catastrophic for that client, and it does not affect the death benefit. So what you're telling me, if that client got a heart attack, stroke, or cancer, they'd get $50,000 from the critical illness from the Health Choice Select, and they get another $26,000 or so from our HO Flex product. And if they died the next day, the family still gets the $56,000. That's fantastic.
Yeah, it's amazing.
That's fantastic. That's amazing. I also built into that, Richard, let's not forget the fact that that client also has a no additional cost terminal illness rider built into that. So God forbid that client was deemed terminal as a result of that critical illness, they not only got the 50,000 from the Health Choice Select, they not only got the additional 26, but they got an additional 75% of this $56,000 was released to them for the terminal illness right. That client, in essence, has just gotten more than $100,000 of critical illness income, lump sum benefit paid to them for catastrophic issues. I think we've solved the problem.
I think so. It's a beautiful thing.
It's a beautiful thing, Richard. Now, you want to show us how we can do this on the group?
Yep. Now we're going to look at a group quote. So let's just refresh this. Okay. So now we're going to go where it says new and click on it. And we are going to go to group quote. And the first thing I'm going to do here is name our group quote, and we're going to call it, Tom's Tavern. Okay. Then what we need to do is first thing we got to do is upload a census. So we're going to click upload census. Oh, excuse me, my fault. First we have to download the template. So we downloaded our template, which will be up here in just a second. And what you'll need for a group quote is the full name, birth date, gender, smoker, non-smoker, the state, and the zip code. And you can use this template. And I'm just going to use the example line here. And we're going to just put it so there's about 16, 17 employees here. We're going to click on copy cell, and then we're going to download this. We're going to save the information. Okay. Okay, once that's saved, we can get away from here, and we are going to upload the census. And that's our census right there. And we are going to upload that into the system. So now we can do a group quote. So we're going to go and pick the benefits for the quote, just like we did with the other one. We're just going to do two with this one. So Health Choice Select, critical illness, accident. We'll do RX in one of them, and WellMec. So then we just need to pick the specific coverage we want. Health Choice Select. Since this is group coverage, we're only going to give them a $250,000 benefit, silver plan. First column, we'll do 50%. We'll do 2 units of accident, $50,000 of critical illness. We will use the brand wrap 2 for the prescriptions, and we will include the WellMec. For the second plan, we're going to also use Health Choice Select. We'll make this one a little less money and a little less benefit rich. Actually, we won't go. Okay. So for Health Choice Select, for the second column, we'll use silver, but we'll use a 20%. We'll use accident 2 units. We'll do critical illness at 20,000, and we'll include the WellMec. Okay, so now we can click here and see the proposal, but let's make it into a PDF. So we're going to click. First thing we're going to do is the rates. So you can click on rates and get a spreadsheet, or you can show it in a PDF. So we're going to do it in a PDF here. There we go. Okay, so, whoops, I'm sorry, it's over here. There we go. Okay, so here's our PDF of the rates. And the beautiful thing here is, for each employee of the group, it gives their age, but it also breaks down the cost of the different components within it. The Health Choice Select, critical illness, accident, prescriptions, and the WellMec, and gives you the total premium. So they can see exactly what they're getting and what it costs for each component of the package. And then at the bottom, of course, it gives you, for example, this would be $13,100 a month in total premium. One last thing here I'm going to show you. We're going to go back here. Is we're going to make a PDF of the actual proposal, not without the rates, so they can see what they're getting. And you can see here it has option 1 and 2, and it goes through all the different categories of what's covered in the plan. And that is the group quoting software.
Richard, I got to tell you, this is phenomenal because it allows the advisor the power to be able to go ahead and not only break down the comparisons for the client to see in real time versus our ACA competitors and or other competitors we build into it, but it allows the advisor also, for those who do write groups, to be able to line by line break down that cost factor per product inside the stack for that client to be able to see it. This will work wonders when you're dealing with small businesses. And I mean, the choices are endless, guys. This quoting system is exclusive only to AHO advisors. If you're affiliated with AHO in any way, shape, or form, this is exclusively available to you. There is actually a cost to this quoting system. And we've kept this quoting system where the cost of one accident app, go write an accident app, and you can have this for the whole annual subscription. That's a beautiful thing. And the reason why there's a cost to it, guys, one, the technology is phenomenal. It puts power in your hands, but it has to be constantly monitored. This thing is monitored for us on a monthly basis to keep in line with the ACA. Any changes, any anomalies, we're up to date. Now, you know, I got to tell you, Richard, thank you so much for what you did in explaining this and showing the beauty of how this works. Now, while you guys are being able to access to this thing, we're going to show you some of the benefits, the programs we got coming up right now in terms of contests, so you'll have a reason to use the quoting system to be able to sell more business and to be able to take advantage of some of the unique options we have coming forward on some of our really great contests coming up. I want to show you this, guys, real quick. Right now, we're in the midst of our summer bonus program. It actually started March 1st. It's going to end on July 2nd. Okay, it's going to end on July 2nd. The qualification is little or nothing for you guys. This is really easy for you guys to be able to make this. But we're literally paying. You're getting credit in the underage market, which is what we're talking about here. Dental policies, critical illness policies, gap plans, any enhanced accident, any health saver products, and any health choice products that are sold, you're getting credit for that. Okay, so there's additional bonuses which are going to be added here, 50% bonuses that are added for critical illness, whether you sell the rider or the actual CI plan itself on Health Choice Select, and also a 50% bonus for the rider that is also sold. So, and anything that's sold on the e-app. That's additional monies that's coming to you guys that you will be able to receive. We just paid out for the winter cash bonus. I think the last check we sent out was about $9,700 in bonus money to an advisor because they went to work and they didn't have the advantage of having our new AHO exclusive quoting software system. Jerry, I want to pass this back to you, Jerry. I mean, you know, thank you guys for hosting it.
Guys, this is just absolutely phenomenal. Thank you, Mr. Fowler. Richard, guy, you just knocked a home run there, sir. You took 20 pounds of potatoes and you put it in a 10-pound bag, man. You had a short time to do it. That is absolutely phenomenal. Guys out there in the AHO radio world, I think you will agree that everything I said, you were going to be in for a special treat. Clive, again, thank you. And guys, again, this is AHO Radio. This is the agent services and training platform for America's Health Options Insurance Plan. Stay tuned for our future airings. I'm Jerry Bowles, your host today. Thank you, and God bless you.